Safe sex does not equals condom alone. Contraceptive does not equals STI prevention. Safe sex is equals mutual testing, open conversation, and respecting boundaries. Safe sex is not just about avoiding pregnancy. It is about protecting your mind, your body, and your future. As a nurse, I have seen things that I really wish people are aware of before it is too late. On this particular video, I'm going to be sharing with you 5 things nurses wish everyone out there know about safe sex. And I guarantee you, one of them is going to surprise you. If you're just coming across this channel for the first time, my name is Mercy Mary. I am a registered nurse and I am passionate about helping people take charge of their health without feeling awkward, without feeling judgmental, and without having any form of confusion. So let's dive into the topic. So the first thing I personally wish you know when it comes to safe sex is that safe sex does not equals condom alone. Yes. When people hear safe sex, the next thing that comes to mind is the use of condom. Safe sex is not just condom. Safe sex is more than the use of condom. Safe sex is equals mutual testing, open conversation, and respecting boundaries. Consent is not left out. Consent has to be there. So when you respect all each other's boundaries, when you know what this one likes, when you know what this one does not like and avoid it, when you come to a midline, that is safe sex. You respect my boundaries. I respect your boundaries. Safe sex is open conversation. You can talk about sex. You can talk about your differences. You can come to a thin line. You can come to like a point where both parties are happy. Safe sex is open conversation. You talk about it. Safe sex is mutual testing. Because I've heard a lot of people say, I trust my partner. We don't need to be tested. But safe sex include mutual testing. Trust is important, but testing and protection is part of that trust. Trust is important, I understand, but testing and protecting yourself is part of that trust. Remember, safe sex does not equals condoms alone. Then the second thing I wish you know, is that testing is not shameful. Yes, most people are scared of being judged wrongly. That is why they don't go for testing. They are scared when they get to the hospital, they are going to look then in an unusual way. They're going to judge them for having sex. So they run away from the hospital. They are scared to go. They are ashamed to go to the hospital to do this testing. Do you know how nurses see you when you come for testing? They see you as someone that's coming for testing, like the same way they see someone coming to check their blood pressure, to know if their blood pressure is high or low. That is the same way nurses are seeing you, as someone that cares about your health and you are coming to get tested. So as a nurse, it is better for us to see you, to take your blood samples, to take that swab to do test, than for us to see you when things are getting complicated. So please try and go for screening, try and go for testing. Nurses are not judgmental. Nurses are here to help you navigate your sexual health and make you feel better. Then the third thing I wish you know is that contraceptive does not equals STI prevention. Yes. You see those birth control pills, implants, IUD. They are very great when it comes to preventing pregnancy, but they have zero protection for STIs. So I see a lot of people and also parents encouraging their young ones to get the implants, to get a family planning without taking into consideration STIs. Yes, it can protect you from unwanted pregnancy, but it cannot protect you from STI. So if you're having unprotected sex, you are at risk of chlamydia, gonorrhea, HIV, syphilis. These are things you should take into consideration when having sex too. Then the fourth thing I wish you know about sex is that consent is part of safe sex. Yes, safe sex is not just physical, it is psychological and it is emotional. For you to say you are having safe sex, it simply means you agreed to do it. Yes, you have the right to say no. You have the right to say yes. It simply means that there is boundaries. It simply means that your opinion counts. It simply means that you are respected. So if you don't have the right to say yes or no, that is not safe sex. Consent is very important when it comes to safe sex. You have every right to say no. You have every right to say yes. Then the fifth thing I wish you know is that lifestyle matters when it comes to sex. You see, stress, lack of sleep, alcohol and substance abuse, they actually increase risk taking and reduce your protection. It is not just about what happens in the bedroom. It is about how you take care of yourself outside of it too. As nurses, we have seen patients who regret decision made while drunk high. You see some people say, oh, I was drunk. That was why I had unprotected sex. I was drunk. I didn't really know what happens. So you have to be careful because substance abuse, alcohol abuse, drinking too much, drinking excessively, make you, your judgment is being reduced when you drink and when you abuse, like when you take in drugs, your judgment is reduced and you just want to get things done. When it comes to safe sex, prevention starts before intimacy, because once intimacy gets deeper, prevention might be difficult. So before that intimacy starts, it is very important for you to consider prevention at the back of your mind. Very important for you to consider prevention at the back of your mind. So to reduce the risk, to reduce your risk, to make sure you use protection, I would advise you to put yourself in a situation where it is not compromised by alcohol or drugs or lack of sleep and stress. So in conclusion, what I have to say is that safe sex is not just a rule. It's not a rule. It's about protecting yourself and your partner. It's about what? It's about protecting yourself and your partner. As a nurse, I don't want to scare you. All I want to do is to make sure you enjoy sex and intimacy in the safest way possible. Yes, because it is much easier to prevent than to treat. You get, I saw a write-up on Diary of a Niger Girl where she talked about a woman that had complications from STI that was transmitted by her husband, and she died because this infection traveled to her uterus, her fallopian tube, and she could not survive it. PID happened and a lot of things went wrong. So that is why it is very important to focus on prevention than treatment. So if you find this video very helpful, click the subscribe button, turn on the notification bell. Don't forget to like this video. Give the video a thumbs up so that a lot of people tend to see the video. Because the more you like, the more people tend to see the video, the more algorithm tends to favor the video. And don't forget to share with your partner. Don't forget to share with a friend that you love dearly. Thank you very much and see you in our next video.